Welcome to Caregiver Cast with Mary Elaine. Are you overwhelmed raising a family, working full time, caring for a parent or grandparent? It can be challenging when you're doing it alone. Caregiver Cast helps busy, burned out professionals reduce their stress and overwhelm to create a better caregiving experience for themselves and their loved one. Caregiver Cast brings caregivers together with experts who provide information in a variety of areas. In each episode, you'll get tips on topics such as finance, legal, medical, self-care, community resources, mindset, and more. We're here to make your caregiving journey a more rewarding one. Acquire the confidence and skills to be a more capable caregiver by implementing the resources and strategies from these expert thought leaders. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. And now here's your host, Mary Elaine.
Hi, welcome to Caregiver Cast. I'm Mary Elaine, your host, and my special guest today is Jodi Kay Benusa, who will be talking to us about what is a geriatric consultant and what does a geriatric consultant do. Before I introduce Jodi, I will give you some background information about her. As a social worker and seasoned inpatient discharge planner at a level 2 inpatient setting for over 15 years, combined with certifications in social work, care management, and advanced steps of advanced care planning facilitation, Jodi Kay has over 2 years of experience working with residents and families in the nursing home setting. She has a well-defined skill set and superior knowledge to creatively assist you in planning the future of your loved one, specifically with what next steps are right. Jodi Kay tactically created USA Geriatric Services as a consumer navigational system for those in need of help when it comes to planning the future of the aged. She works hard to preserve the rights of aging adults so they can find their best life through the toughest times. USA Geriatric Services serves the aged with true respect, highest honor, and genuine compassion, because here, Jodi Kay believes every client is the most important person in the world. Welcome, Jodi Kay. How are you?
Well, thank you. Thank you so much for having me. I am doing well. I'm doing well. I just a side note before we dig into this. I am very happy with how calm I'm feeling in the midst of the chaos that's going on in my home right now. I'm moving and I have about a week and a half left to pack. And here I am. I carved out some time to be here with you today. And it is just my pleasure to talk to you.
Well, thank you for being so calm and being a guest today while you're going through the packing process. I know it's not easy. I moved from Massachusetts back to Colorado, and I can say that it is quite the experience in this country. So I hope you're moving closer to where you're living now compared to across country.
Yeah, not going cross country, but it's really giving me a whole new perspective, what it feels like for an elderly person to have to downsize when it's time to move into a senior living community. So
yes,
I've been really thinking a lot about that as I'm purging and getting rid of things that I really don't need. Interesting.
it is. I'm going through that process now with just my therapy materials for speech language pathology. So I totally understand where you're coming from. So tell me, why did you choose to become a social worker, and where did it begin?
Well, sure. So I love this question. Actually, this is like one of my very favorite questions. I really tell people that I was born a social worker.
Hmm.
I have a lot of very early childhood memories. And I can clearly remember being in a play group when I was maybe three. And if I was playing with a doll and if I saw you sitting across the room and if I thought, I bet you would enjoy that doll just as much as me, I would go give that doll to you. Even at that little tender age of 3, I had that caring heart. And then I can remember in elementary school, we'd be sitting at the lunchroom table, and if you were sitting across from me and if I noticed you didn't have any dessert or anything in your lunch, I would say, you know what, my mom packed this chocolate chip cookie in my lunchbox just for you today, and I would give you my cookie.
Oh,
And then it carried over into high school, like it just kept going. And in high school I sacrificed almost every study hall that I had to tutor the kids that needed more help in English or math or science or anything like that. So my answer to that is I was born a social worker. So yeah.
I can see that it's a perfect combination, given your history since 3 years old, that you're here to help people in any way possible. So what was your first social work experience like, and how did it feel to you?
Yeah, I think my very first actual real social work experience, when I could call myself a social worker, was when I was working in the nursing home.
Mhm.
I clearly remember sitting down with those elderly people and chatting with them and talking with them and realizing at that point how important that population is. So much to learn from them, so much to glean. And I wanted to take every opportunity I had to learn lessons, life lessons from them. And
Mhm.
I have taken some of those life lessons and brought it into my current work now. So that was actually my very first experience as a real licensed social worker. So yeah, I fell in love with the geriatric population right then and there. We all love our grandparents. We all have great stories and fond memories of our grandparents. But really, that's when I embraced how incredibly important the geriatric population is.
I appreciate you saying that, because I think a lot of people in our society now tend to dismiss the seniors and
Yes.
that population. And it's really sad because, like you said, they have a lot of life lessons that
Hmm.
you can glean from. And it's so important to chronicle that and to give life to that and respect to.
Yes.
How did you then move from social work in a long-term care facility to finding medical social work?
Yeah. So I always have been intrigued with the medical world. I was born and raised on a dairy farm, so really understood a lot about uh, the bovine world.
Mm-hmm.
Oh, I would help the veterinarian. I would help him do surgeries on the cows and help calves be born and all the things. So I've always had that interest in the body, in the medical field.
Mm-hmm.
But when it came time for me to really choose a career, I realized that nursing wasn't for me because I wanted to be involved, but I didn't want to have to touch anything. So I chose social work. So I moved out of state to where I currently am, and quickly found this job at a hospital.
Mm-hmm.
It was a level 2 trauma center. And I was hired kind of immediately on the spot. And that is where my love for medical social work started. I did apply for lots of other social work jobs,
Mm-hmm.
county social worker, um, uh, uh, children's and family social worker. It wasn't for me, not at all. And I was offered jobs and I actually turned them down because I could tell that that was not a good fit. But when I was interviewed for that medical social work job, this is
Mm-hmm.
it. This is the job I want. So that's kind of how I found that, kind of exploring some of the other avenues of social work and really landing and honing in on the medical social services.
I can appreciate that. I was helping, I was a home care director for a hospital, and I was able to help some of the discharge planners and social workers discharge patients from the floor. So I totally understand where you're coming from. In fact, in one situation, there was a patient whom the respiratory therapist felt needed home respiratory therapy the day of discharge. And I said, fine. I had to call a former manager of mine
Mm.
and just really ask her that she had to send somebody out. So it was kind of interesting that I was talking to a former manager and now as an equal to have someone come out and help that patient
Yes.
so that they knew how to use the oxygen equipment appropriately. So I understand. I love working in that hospital environment.
Yeah.
So can you share about some memorable cases and why you know you were in the right field?
Sure. So I worked in the orthopedic and neurosciences units. They were side by side for almost 16 years.
Wow.
So and I never changed. I stayed right there. Some of my favorite cases were the traumatic brain injuries. And a lot of people don't equate a stroke with a traumatic brain injury.
That is true. And they are separate, but just, they are the same.
Yes, yep. So I really was intrigued with how I could help folks that had traumatic brain injuries, whether it be from a fall and bumping the head, or even a stroke, which was quite significant. So when I'm thinking of this one case in particular. Beautiful young woman, was riding her horse, and the horse bucked her off, and she landed on her head, and she had a really, really bad traumatic brain injury. They kept her alive, they kept her going, and slowly she started to come back. She started to wake up.
Mm.
I remember working with her and her mom, and me just taking that extra time. I was on the med surg floor, the ortho neuro floor, not in critical care. But I remember I knew that I was going to be getting her as my patient, and really sitting down with the mom and helping that mom just work through the fact that her beloved daughter, was leaving the arms of critical care and now up to a med surg floor. A lot of people don't realize the stress in even that simple move. We just assume that, it's a good move because we're out of critical care.
Yeah.
But I really spent a lot of time with that mom. And then when it came time for them to get ready to start thinking about discharging from the hospital into a rehab center, days I worked with that mom and answering her questions, talking her through it, setting up scenarios. And she left. She was able to go to a brain injury program. And I will never forget, Mary Elaine, I will never forget. I was sitting at my desk several months later, and I heard, excuse me, Jodi. And I turned around, and it was the young woman.
Are you serious?
It was phenomenal, absolutely phenomenal. And to hear the mom say, Jodi, I don't think I would have survived all of this without your help and your guidance, because you helped prepare me. You explained things. You took the time and the effort to make sure that I was taken care of too. So that is one of my most memorable cases. So another case that comes up for me, and I won't belabor this point too long, but some people are really going to be able to relate to this. I can call it a case, but I really wasn't working. It was actually my stepfather.
Hmm.
He lived out of state, and I was literally watching him deteriorate before my eyes.
That must have been awful.
He was declining. It was not good. And I dug in and found out that he needed gallbladder surgery. And no one was taking it seriously.
Oh,
And I
goodness.
pushed and I pushed and I pushed. And I called his primary care physician, and well, we can get him in for an H&P, a history and physical, in a month and a half. I said, no, no. I mean, he was dying. He needed this surgery. And finally got him in, and it was just a horrendous situation. Within a week, I got his H&P, got him scheduled for surgery, and he had his gallbladder removed. So, but I think it was just this, the point is I understood the healthcare system, and that's how I knew I was in the right profession. Had I not had all those experiences that I've had at the hospital, I would never been able to help him like I did.
Mhm.
So I knew at that point that, you know what, I can help people no matter if I'm in the hospital or out of the hospital. So that understanding of the intricate tangle web of the healthcare system, I know how to maneuver and get around. So
Wow, those are really profound set examples of what the work that you've done, and I really commend you for it, because you're right. The healthcare system is pretty fragmented,
mhm,
and they need someone such as yourself to navigate that whole maze to get through and to get things done in a timely fashion. I mean, that would have been horrible to see your stepfather deteriorate like that and not be able to help.
mhm. Yeah.
Um, what struggles did you face when, as a social worker in this environment?
Oh gosh, I could go on for hours about this question. So what's really coming up for me, like right away, like what struggles? Probably the biggest struggle was finding how to, and I'm going to use air quotes here, finding out how to beat the system so I could
Uh,
actually provide good patient care to my patients and their families.
mm, mhm,
Um, Medicare has rules, hospitals have regulations, and they both need to be followed. I understand that. But those rules and regulations really don't serve the patients or their families very well.
mhm,
So I really took it upon myself to find loopholes and ways in and out and up and around to make sure that everyone was getting what they needed. So a big struggle, I got in trouble a lot.
I noticed that you were considered the difficult discharge queen. Oh
Yes.
my goodness, Jodi. I
Yes.
would have never thought that of you. However, okay, explain.
Yeah, I was kind of known as the difficult discharge queen. So, we would get patients sometimes that would come in the hospital. Maybe I'll just use this as an example. Somebody in your audience might relate to this. Somebody is living in memory care and has some pretty good dementia going on. Um, and then the assisted living or the memory care just can't handle them anymore, and they drop them off at the emergency room, and then they refuse to take them back. So what do you do?
Oh,
That's a difficult case. How do you find a new memory care unit that can accommodate and help this person thrive?
mhm,
So those kinds of cases I became very, very good at. When that would happen, when I would have a client or a patient that would be dropped off at the emergency room, or maybe even a family member would say, I can't take care of them anymore. I
mhm,
don't know what to do.
mhm,
Um, Before I would accept a no from a community, I would have a one-on-one with the director of nursing. I would talk to the administrator. I would talk to the social worker. I would talk to the family. And I would say, let's bring up and let's bring forth all of our barriers,
mm,
allowing this person to come back to home.
right.
Let's see if we can knock those barriers down. Let's work on those barriers.
Mhm,
Maybe we need some medication adjustments. Maybe we need this. Maybe we need that. Let's try this. Let's try that. So I
mm,
really worked hard at getting my patients back home. So not very often did I not succeed at that. But if you get the barriers on the table and if you talk about them and we are honest with each other, we can generally break those barriers down. And then it came that when other social workers in the hospital would have clients like that, my manager and the other social workers would come to me and say, Jodi, how do we do this? How do you do it? What do we say? What can we do? So that's how I kind of became known as the difficult discharge queen, and always coming up with a plan B and always another option or a better option. I never just stopped at the first thing that happened. If it wasn't right for my patient or my family, let's see what else we can find. Let's see what other options are available for you.
Wow, kudos to you. So getting back to this patient that was dropped off at the ER, how did you get the memory care unit staff to buy into this, and what changes were made?
Sure. So I worked very closely, and I still do, with my clients' physicians outside now. But when I was at the hospital, I worked very closely with the physicians and the nursing staff. And I would come up with documentation, and the nursing staff sometimes got a little frustrated with me, but that was okay. I was okay with that. I would have them document every hour on the behaviors, so we can start to see a pattern and kind of work through when behaviors were starting and what maybe was causing them. Then I would work with the doctors and the nurse practitioners. Hey, is there any kind of a medication tweak that we can do? I know you're not the primary PCP here. I know that you're not, but you're in care of this person now. So let's see what medication adjustments that we could do. After we got through all of that and we got the behaviors under control, then I would always invite the community liaison, the director of nursing, the administrator to the hospital and sit with this person for a while and pop in unexpectedly. And let's see if there's any way that you can see that this client, this patient is better behaved and can come home. So, and it was mostly just me finding patterns, finding things that we could do differently, things that we could do better, and even teaching some of those things that we discovered to the memory care staff.
Exactly. Wow. I give you even more kudos because I know that you have such a large caseload of clients, and to go above and beyond and have like all of those people at the memory care unit come in and now see the difference in the patient.
Yes.
In order for them to then accept the patient back with like the structure that you put in place.
Yes. Yep.
Wow. So how do you help families now, and how does it compare to when you were a medical social worker in this level 2 trauma center?
Sure. What has been probably the best part of opening my own independent business is the fact that I can actually now help my clients without getting in trouble. I kind of have this little joke.
That works.
Yeah, I kind of have this little joke. So I'm the little worker bee here. And if we have a situation, I'll say, just a minute, I got to ask the boss. So then I ask myself, how would you tell Jodi to handle this? And I love having those conversations with myself. It really helps me get through difficult situations. How does it differ? I think it differs that I can get more involved. I have more time to be involved. My clients now have my full attention, whereas before at the hospital, I had to divvy up my time. I don't do that now. My caseload now is sort of like handpicked, and I work with only a few clients at a time, so I can give you everything I have. So really what I've done is taken that very special skill set from being that discharge planner at the level 2 trauma center. And I only say that because we had the worst of the worst cases.
I'm sure.
Yep, that's why I include that level 2 trauma center. We didn't ship our people out. They all stayed with us. But I've taken that skill set now and brought it to the public. So not many people really understand the healthcare system like I do, and how to weave and get in and around. And exactly, the doctors would come to me when I was working and say, Jodi, what do I need to say in the discharge summary?
Oh my goodness.
What do I need to say to make sure that Medicare covers this rehab stay? What needs to be included? What should I not say? So
Mhm.
I really understand the whole, the ins, the outs, the ups, the downs, the inside and outside. So yeah.
Oh my goodness. That speaks volumes that the social workers and the physicians would come to you, because even though you were known as the difficult discharge queen, they valued your skill set and your ability to, like you said, go up and around and under and through and
Yeah.
all of that to really get the best outcome for your patients. And
Yeah.
I admire that, because I know how challenging that must be, especially when you have a challenging case,
Mhm.
like that young woman with the traumatic brain injury, and with this woman from the memory care unit.
Yeah.
So I understand. They may I share just a quick story with you?
Oh, I would love it.
Well, the senior social worker and her team decided, I was supposed to discharge this young man who had a traumatic brain injury back to the nursing home. However, instead of putting in a central line for him, they decided that they were going to do put a line in through his arm. So of course now the poor young man is contracted, and now it's like, I don't know, 6 or 7 at night, and I'm trying, the infusion nurse is there, the charge nurse is there, and they left the area for a short time, and I'm in the process of contacting the father, because he had to give both nurses verbal okay that
Right.
they insert the IV line. I couldn't get a hold of the father initially. Then I tried, I guess, this young man's sister.
Mhm.
And a short time later, the father did call me back, and now I had to find both of the nurses so that they could get this verbal permission from the father. And the challenging part, that was even more challenging, was that the father was in another hospital in Boston watching his wife pass away.
Oh.
So yes, so that was a really challenging case for me, because we did get the permission to get the IV line in. But I understand what you're saying.
Yeah.
It's
Yeah. It's so important.
mm,
And in my world now, when I help people find the right senior living community, or if someone hires me for my emergency consulting,
mhm,
it's so important to make sure that every T is crossed and every I is dotted.
mhm,
And I know what T's and I's need to be crossed and dotted. So
mhm.
that's why it's important to go with someone that actually understands the system.
Oh,
Um,
definitely. And I wish you could clone yourself
yeah.
across the United States, because I think a lot of families are in situations where they don't know how to access services. They're in a family crisis because
Yes.
something has happened
Yes.
unexpectedly, and now they're faced with all these decisions to make. And
Yes.
it's definitely more challenging to make those complicated decisions when you're already under a lot of pressure.
Yes. You know, I get so many calls on a weekly basis from people that are in an emergency. And here's a classic example of when someone would call me for that hourly emergency consulting. And that is, hey, Jodi, my mom is in the hospital.
Mm-hmm.
They're discharging her home. She can't walk. I can't take care of her. Nobody is talking to us. We don't know what to do. Can you help us?
Mm.
So I know that that is just so common. And yep, I have talked to doctors. I have talked to physical therapists. I have talked to bedside nurses, hospital social workers, and I have gotten great results in when somebody is in an emergency like this. Because when, like you said, when you are in that crisis, you can't think straight.
You can't.
And how do you even know what questions to ask?
Well,
And you know,
mhm.
doctors can be intimidating. They don't intimidate me because they put their pants on just like I do. But you know what? They are under pressure too. They really are, to get people out of the hospital. But sometimes it's just not safe. I'm thinking right now of one woman who the family called me and said, Jodi, we can't take care of her any longer. So I said, here's what I'm going to have you do, and you're going to get some pushback. I want you to take her to the urgent care and say, I can't take her home. I can't
Mm.
take her home. So long story short, I was able to talk to the doctor. I was able to talk to the social worker and to the physical therapist. We got her a physical therapy eval. She was admitted into a skilled nursing facility the very next day because I knew what to say, I knew what to do, and I got the process done, and everyone won.
That is incredible. That is so amazing, especially I'm assuming because another layer to that would be that there wouldn't be any a medical power of attorney or a durable power of attorney or any mention of any legal or medical documents in place. So kudos
Right.
to you for getting that patient what she needed.
Yes. Thank
I
you.
see that all the time though, too, because, you know, some of these patients are discharged home after a short hospital stay. And then what do? I mean, they aren't really ready to go home,
Right.
because if they stayed in the hospital an extra day or so, they would be better ready, I guess, to be discharged, and there would be less Medicare rehospitalizations, 30
Readmissions.
days or
Exactly.
less.
Yeah. Yeah.
So, yeah, it's amazing how crazy the system is, and that they don't realize the care that's needed, let alone the reimbursement issue all around. So,
Right.
um, it's a great way to segue into, are there any cases that may be too difficult for you or anyone else to handle?
Oh, goodness. Are there any cases that might be too difficult?
Mm-hmm.
I don't think that there would be anything that I wouldn't try. Let me say that.
Okay.
The one thing I'm going to be honest and upfront is that when I do take on a new client, when we both agree that it's a good thing for us to work together, I do expect my clients to do as I say.
Okay. Well, yes.
Yep. So because it can be difficult if I have a client that says, okay, I'll do that when I'm ready.
You
It
can.
doesn't work. It doesn't work that way.
No, certainly doesn't.
So, but no, I have done some really interesting casework. I had a man that was deleted from the Social Security system.
Yes, I remember that story.
Yeah. So that was interesting. So I had to be like Nancy Drew and uncover, got the congressman involved, and it was quite interesting. Gosh, I have done so many other things. I can help with guardianship processes. I know that system well. I know exactly what to do in those cases. I participated in those all the time when I was at the hospital.
Mhm.
Yeah, I know. I don't think there's anything too difficult that I wouldn't try.
I would certainly expect you to do everything possible,
Yeah.
no matter what, Jodi. That's why I'm having you here today.
Oh.
So are there, with all of this vast knowledge that you have, are
Mhm.
there like 3 tips that you can give families and or caregivers to help them navigate the complicated medical system, or what recommendations would you make to have them work with you so that they could get the best possible outcome?
Sure. So a couple of things are coming up for me when you say that you want 3 things. So these 3 things are kind of like popcorn in my brain. The first thing is, please have those difficult discussions with your aging loved one before a crisis happens. I can't say that loud enough and strong enough. Have a plan. Know what you're going to do.
Mm-hmm.
Mom,
I
if
agree.
you fall and break your hip, what are your wishes? What are we going to do? Have those conversations. Have some kind of a plan.
Mm-hmm.
The second thing that's coming up for me is, if you do find yourself in that emergency kind of a crisis situation, your loved one is in the hospital, make sure that you ask questions. Ask every question that you can think of. Um, Gosh, don't be pushed around, don't be shoved around, stand your ground. And you
Mm-hmm.
might have to become that relative that kind of wears that oh great, it's her label. But that's okay, because somebody has to advocate for your loved one.
Yes.
And the third thing that's coming up for me is, when you know that there needs to be a change in a care plan, or if you know that something's got to give and your aging loved one does need more care than you can provide, don't wait too long.
Right.
That is the biggest mistake that people make, is waiting too long to find help.
That's really great advice. I been hoping through the podcast and with guests like yourself to have caregivers understand that, yes, they should have a plan in place.
Yeah.
And the sooner the better. I totally get that. And yes, they should be reaching out for help as much as possible. And
Mhm.
yes, they should be also advocating and asking those challenging questions when you're in one of those emergency situations and you need to know exactly specific information to know how to make the next step.
Yes.
Thank you for sharing all that great information. So how can my listeners contact you if they are in those kind of situations, or in any situation where they need your support in order to make things happen?
Couple of ways. If you know that you would like to schedule a call with me, the
Mhm,
easiest way, I do offer a free 30-minute, I call it a clarity call. You'll
mhm,
see it all over my website. There are tabs that you can click, and it will take you to my calendar. I encourage you to schedule a call with me.
mm,
During that call, it's not a sales call, but during that call, I listen to you, and then together we decide if this is something that we can work on together. So
mhm,
it's just a great time. I always ask at the end of my clarity call, if this call has not been a perfect 10 in your mind, what could make it better? I
yes.
always ask that, because it is important that I meet you where you are, and we decide together
Mhm,
if it's a good fit. So go to my website, click and schedule a call. Again, it's a free 30-minute clarity call. The website is the business name, www.usageriatricservices.com. But if you are in a crisis, like it's happening now, and I
mhm,
don't have time to schedule a call, feel free to call me. And if I can answer the phone, you got to know that is one of my strong points is that phone is ringing. I do everything I can to answer that phone. If I can't answer it, I can't. So feel free, anyone can call me, 608-519-2404. And that phone number is also on my website. So yeah, there's lots of different ways to get in touch with me, but I love the hourly emergency consulting. I love getting in there and getting your crisis solved. That's my goal. I also do some hourly caregiver coaching. I really, really enjoy doing that. I, in 1 hour, can give you the tools that you need to overcome that current crisis that you're in. Let's say that your loved one is not taking their pills and it's driving you nuts and you just can't deal with it any longer. Jodi, can you help me? Yeah.
Of course.
I can. Yep. So one coaching session, I don't do long-term coaching. It's kind of a one time and I give you the tools. I can coach you through that and show you the tools. So the next time another crisis comes up, like maybe she won't bathe, you can pull those tools back out and coach yourself through it. So also I love doing that. So specialized, individualized placement services, emergency consulting services, and caregiver coaching. Those are my specialties.
Thank you so much for giving us those 3 areas that you specialize in, because I think all of those need to be in a caregiver's back pocket, so to speak.
Yes.
So please, everyone, please give Jodi Kay a call, contact her at her website, and with her phone number. I highly recommend Jodi. She comes with a vast array of knowledge and resources to best help you get through any situation that you're in. Jodi, thank you so much for being here today.
Thank you so much for having me. My pleasure.
Thank you for listening to the Caregiver Cast today. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. Get involved with the show. Send your email to mpetrusi2002@gmail.com. And we'll see you again next week for another episode of Caregiver Cast.